What is your plan to ensure that all Oregonians can access and afford adequate health care?
I have a pretty on the ball plan for this because I have personally dealt with this experience of not having good enough healthcare options. Even in Lane County, which has the largest hospital and highest concentration of doctors, there's still an absolutely dismal doctor shortage. And worse than that is the negative impact on the doctor-patient relationship because of the corporate healthcare model. So what I'm promoting is market-based reforms. It's called direct primary care. And this is essentially a subscription-based service where you get unlimited appointments and advice from your doctor. And yeah, honestly, it makes more money for the providers and gives a superior quality of care to the patients. I think this can be established nationwide. I think every state has an incentive to do this, not just Oregon. And as a federal measure, Congress can really help get this going by making independent doctors tax exempt from income on their direct primary care subscriptions. So, like me personally, I have Medicare and Medicaid. I can't get a doctor in the Eugene area that can treat my injuries and conditions. So I have to use this model, even with a dentist. I can't get in with a dentist anywhere in the city. So I use a private dentist who uses an incredibly cost efficient subscription model. I get superior service. And once again, these are things that if the state used this model, it would save thousands upon thousands of dollars, even for the most basic patient issues, and completely clear the glut out of long wait times. So really, I'm supporting the direct primary care model, and you can learn more about that at voteforstrek.com. This works for pretty much any situation that has been negatively impacted by modern healthcare.
Access to affordable health care is one of the most pressing issues facing Oregon families. In many rural communities, people are literally driving hours just to see a doctor, and that is unacceptable and certainly unacceptable in an emergency. We need to focus on expanding our healthcare workforce by creating an attractive environment for that workforce right here in Eugene and other areas in the district, but also, very importantly, in many of our rural communities. We must support rural hospitals and clinics by removing barriers that prevent providers from practicing in underserved areas. Telehealth also has tremendous potential to expand access, especially in rural Oregon, but that is only one part of a number of common sense solutions. We must also work to lower costs by increasing transparency, encouraging competition, and reducing unnecessary administrative burdens that drive up prices. Patients should know what they're paying for, and providers should be able to spend more time caring for people rather than navigating a bureaucracy of red tape and paperwork. I will champion efficiency and accountability at all levels. Fraud, waste, and abuse is draining our resources as well in our medical care system, as it has for many years. And I will advocate, take every opportunity to stop that fraud, waste, and abuse. My goal for Oregon is simple. It's accessible, affordable, high quality care for every Oregonian.
I support measures that allow for universal health care and Medicare for all. I believe that particularly in this district, we need to continue to improve the infrastructure of healthcare, not just for our veterans, particularly with the Roseburg VA, but also we need to continue to improve the healthcare systems, particularly on the coast. And we need to be putting into place measures that help people not just survive, but thrive. in their spiritual, mental, physical, and emotional health and well-being. And in order to do that, we need to be looking at implementing structures that allow people to have not just access to healthcare, but also to make sure that we are creating systems where people can afford their healthcare so that they aren't going bankrupt from their medical bills.
Since 2010, when I was in the legislature and I was, an original co-sponsor of the Medicare for All bill here, the Healthcare for All bill here, I believe that we should have Medicare for all. It is the most rational solution to the problem of having people have health care. We shouldn't have people going bankrupt. I mean, previous to the Affordable Care Act, my county, Lane County, had a 21% uninsured rate, and over 50% of the bankruptcies in the United States were because of health care costs. Now, this administration has cut affordable health care subsidies, so people are not able to afford health care. We have venture capital firms and hedge funds buying up our healthcare systems, and they're taking money that isn't going directly to caring for people. And fundamentally, we just heard that because of this illegal and immoral war that Donald Trump started in Iran, they would like to gut more healthcare spending so that they can spend it sending bombs over to the Middle East. Fundamentally, this is the number one issue I hear about in both my conservative and liberal areas. It doesn't matter, Democrat or Republican, people need access to health care. And as someone that represents a lot of rural communities, we are getting hit the hardest with these cuts. And this is one of the reasons why I'm running for office and want to make sure that Democrats have control of the House and hopefully control of the Senate.